know if the health secretary is going to meet his own target that he used as a distractionary tool to change the agenda from criticism of the government to a positive. We're going to be testing 100,000 people a day by the end of April. It is now April the 22nd, and we're actually testing less people yesterday than we tested 12 days ago, which I would argue is a spectacular failure. What would you call it?
So we know that testing is really important, and so we have been working hard to ramp up the testing capacity in the country.
I don't hear about you ramping up though, Care Minister, with respect. You're not ramping it up. I've just told you you've done 18,000 yesterday, and that is less than you did 12 days ago. So when you keep saying you're ramping things up, actually you're not. You're going backwards. You see?
So we have trebled the amount of tests that we can do since the beginning.
You're not doing them.
People can't get to
You're
them.
doing 18,000 a day, which is less than you were doing 12 days ago.
Well, if you'll let me finish speaking, I
You're
will
answering
explain what
different
we're going
questions.
to do.
You keep talking about capacity. I'm asking you how many you've done.
I'm giving you the context and explaining both sides of the equation. One, I won't say it again because you will probably interrupt me, is access, is the capacity, and the other is the access to tests, and increasing the number of people who are eligible to come forward and get that testing. So we started off with patients in hospital and then NHS workers. We extended it to those working in social care, and that's those in care homes and those providing domiciliary care. I'm looking at whether we can extend testing to personal assistants who are employed by people who pay through direct payments. And we're also extending it to other key workers. So, for instance,
you should have been doing all this weeks ago, with respect, Care Minister, and the fact you're still doing less yesterday than 12 days ago shows me this 100,000 figure was just plucked out of the air and is complete nonsense. Let's turn to the number of people who've died from COVID-19 in this country. How many is it?
So we've now seen just over 17,000 deaths in hospital, and the ONS have told us yesterday that they have a figure of 1,043 who've died in care homes.
So you think it's about what, 18,500, 19,000?
So I think we probably have seen more people than that die in care homes, and I hope that.
How many? You're the Care Minister. How many more have died than the government figures?
So next week, I hope that we will be able to publish figures specifically.
I don't want to wait a week. I want you to tell me as Chairman. We had this conversation last week, and you didn't know then. You've had a week, so you keep saying next week. Now, I'd rather concentrate on the now. How many more people do you believe, as Care Minister, have died in care homes than the government's official figures?
So the situation with the data that we have at the moment for deaths of people in care homes is it includes some who have died in hospitals. So it's an inaccurate figure and would be misleading because of that double counting. So what we're doing is we've started changing the way that we collect the data, so that we will be able next week to publish a specific figure for people who specifically died in care homes.
The Financial Times has a specific figure today. The Financial Times says it's over 41,000.
That's not a figure that I recognise, and I think that probably suggests one of the problems with using data that isn't necessarily accurate and hasn't been validated. And I think it's really important.
So you're saying the Financial Times, who've done a very detailed analysis of this, which I suggest you read, that the Financial Times has made this up?
That's not a figure that I recognise in the slightest.
No, I know you don't, because you don't know how many have died. It's hard to recognise it when you've no idea what the number is, isn't it?
So what I said is we will come next week and we will publish the figures.
You said this last week, Care Minister. I mean, you come back on this programme after what many thought was a train wreck interview last week because you didn't know these numbers, and you still don't know, and you're still saying, I'll come back next week. At what point do you come back and actually have an answer? The reality is, if you study the FTPs, which you should, you're the Care Minister, you should have been aware of this and read it all, you would see that there's a very good reason to believe that it's over 41,000 people, including thousands and thousands in care homes. That's the reality. And that is your purview. That is your job, is to know this stuff. And I find it, frankly, I've said this to you before, I find it incredibly insulting that the Care Minister has no idea how many people are dying in our care homes. These are elderly, vulnerable people dying of COVID-19, and you are not taking their deaths seriously enough. People who die in hospitals are getting treated with more respect than people that die in care homes.
So that's an incredibly unreasonable accusation. I take every single death extremely seriously. I would wish that nobody would die, but the fact is that this is a horrid virus, and we know that those who are in care homes are amongst the most vulnerable because of their age, because they have underlying health conditions, and if they catch coronavirus, they're at greatest risk. And I've been quite straight with you and others I've spoken to that we know that people are dying in care homes, and we know that more people than usual are dying in care homes. And that is why we're, on the one hand,
the Financial Times
really
says
hard
that,
to make
contrary to your figure of just over 1,000, the Financial Times. Well, let me put a point to you that you can.
Just going to keep on. The problem is you just keep on interrupting.
No, the problem is, Minister, you don't have any answers. You just waffle. Right, the Financial Times says 11,000 people, based on their analysis, have died in care homes. You say it's just over 1,000.
Well,
they have an 11 times death toll. And the reason that matters, Minister, the reason that matters, Minister, is if their figures are right, then the UK has the worst death toll in the world after America, and is literally right neck and neck with America, which would be a scandal of epic proportions. Would you agree?
So I'm saying to you that we're working to make sure that the figures we have don't duplicate, so that we can publish next week data that has got hospital deaths and the deaths in the care sector, care homes and in home care and other settings. And I think it's really important that we share accurate data. But what I also know is that people have been dying in care homes, and it's incredibly hard to control outbreaks in care homes. And that is why I'm working, and we are working as a government and with local authorities and with the NHS to provide care homes with as much support as we can, and looking at what extra support we can get to them. For instance, what extra support from GPs and from community health services to support them.
Okay, so Patrick Vallance, the Chief Scientific Advisor to the government, said that 20,000 deaths would be considered a success. If the real figure is already over 40,000, what do we call that?
Look, all the way through, we've been taking the scientific advice, following the guidance of the Chief Medical Officer, the Chief Scientist, and we will continue to do that. I think everybody, it's much so every step of the way, we're learning about the virus and how best to control it and manage outbreaks, and learning about how we can best cope with the pandemic. We also have known all the way through that it would be the case that people would die who would otherwise.
Okay, do you know how many people? Do you know how many people? I asked you this question last week as well. Do you know how many people have died in the healthcare system, both in hospitals and in care homes?
So, as I have
the workers, the healthcare workers, the care workers.
Oh, healthcare workers. So we know that 61 NHS workers have very sadly died. And we have a figure at the moment of 15 care workers who have died.
See, these numbers again are completely wrong, and I'm going to show you on our screen here that the real figure of all the people who work in the NHS and all the people who work in care homes have died is actually 111. So once again, you as a government are massively understating the scale of what is going on in terms of a death toll for our healthcare workers and for the care home workers. And I once again put to you, as a care minister, why are you not setting up a system that allows you to give accurate information and to treat every one of these lives with the respect that they deserve?
So we are indeed setting up the systems to make sure that we have accurate data, and that is why we are careful to make sure that we use data that we know is accurate, and for instance that the deaths have been confirmed, and we don't want to mislead people. So that is why
I'm mislead people.
This is why I'm giving you the
Sorry,
information.
with respect to you, Care Minister, I'll tell you what's misleading to people. When you claim as a government that we've only had 17,000 deaths, and actually the real figure is highly likely to be nearer 41,000. That's what I call misleading people. Anyway, we've got to leave it there. No doubt we'll talk to you next week when you've now said you'll have all the right figures for us. I look forward to talking to you then with those correct figures. Let's end on a bit of fun. This is Joe Root, the England captain, talking about Captain Moore.
Obviously what you've done is amazing, and you're a huge inspiration to the nation.